Oh, there we go. Good afternoon. Today is January 22nd, and it is 4 o'clock. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. First item of business is public communication. We will receive public communication for both the Executive Committee and the Board of Managers meeting before we proceed to the Executive Committee meeting. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 2:30 p.m. today. So, did we have anyone registered to make comments?
Yes, we have one person registered to speak.
Okay. Is that person in person with us?
Yes.
Okay. So let's proceed with public comment.
Perfect. I'm first going to read the guidelines for this meeting's public communication, but in the meantime, Ariana Gomez, she's there in the room, and I'll read off the guidelines. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number after your introduction. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new agenda issues for discussion at a future meeting. And Ariana Gomez, are you all set?
Wonderful. Thank you all. Can y'all hear me? Great. My name is Ariana Gomez Lopez. I'm the Public Health and Policy Strategy Policy Specialist for the strategy teams here at Central Health. And I'm also, in a personal capacity, a volunteer at the migrant shelter Frontera Digna, which is located in Piedras Negras, which is a border town 4 hours away from here. So I just want to convey my gratitude towards Central Health because during last month in December, with the support of Central Health leadership, I was able to organize a donation drive for the migrant shelter in Piedras Negras. The migrant shelter currently, on a regular basis, serves 200, 300 people. During the holiday, they had a higher influx of 800 people per day that they're clothing and feeding. So as a volunteer, I felt called to action, and I had the support of my employer to do that. So we organized a drive, and we were able to take a truckload of essential supplies during a critical time to the shelter. So I would like to follow up the donation by presenting this letter from the religious sisters who run the organization, thanking Central Health for their generosity and support and kindness. Although I don't have enough time to read through the letter, I have it available. If you'd like to read it, I'll be here for the rest of the meeting. Or I can also follow up with it online. It is in Spanish, but there is a translation. There's also photos from the drive. So I would just I'm profoundly grateful for everyone who donated and for everyone's support during this donation and during a challenging time for our brothers and sisters at the border. So I would like to convey not only my gratitude, but that of the religious sisters running the shelter. And thank you for making a positive difference, not only here in Austin, but across the border as well. So thank you. That is all. Thank you.
Thank you so much, and thank you for your service at the shelter. So,
absolutely, thanks.
And this concludes public communication. Thank you. Thank you, Ariana.
Okay. Let's see. So, we will now proceed to the Executive Committee agenda. The first item of business is to approve the minutes of the Central Health Executive Committee December 13th, 2023 meeting. Do I?
Yes.
Do you want to move the?
I move that the committee approve the meetings of the Central Health. I move that the committee approve the minutes of the Central Health Executive Committee meeting of December 13th, 2023.
Okay, we have a second from Dr. Martin. All in favor? Okay. Passes, that's unanimous. Item number 2, discuss and take appropriate action to approve the formation of the Ad hoc Infrastructure Committee, which I have proposed creating. So, members, this item seeks the concurrence with my proposed formation of an Ad hoc Infrastructure Committee to continue the work of a committee that was a committee formerly known as the Real Estate Committee that was part of the bylaws. And because that change was made in the bylaws, removing that committee, we need to establish that committee as an ad hoc committee. So I'm proposing that because, well, after conversation with all of you and particularly with Manager Musaitiv, it made sense that we do this now. You know, with the extensive growth in Central Health real estate holdings and construction projects, it's really time for us to reestablish this committee. So, and let me just, I have established a scope for it, and the scope for the committee, I'll read that out so that we have that stated publicly. The scope of the Ad hoc Infrastructure Committee is to review and provide board guidance on use and/or development of real estate infrastructure in alignment with the Central Health strategic priorities and healthcare equity plan. So, any questions or discussion? Okay. Do I have a motion?
Yes. I move that the committee recommend that the board approve the formation of the Ad hoc Infrastructure Committee created by the board chair.
Okay. Do I have a second? Manager Musaitiv? All right, all in favor? Okay, that's unanimous. Thank you. Item number 3 is informational item. Review and provide direction on the following. There's 2 parts to it. The first part is the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. And the second part is the tentative reporting schedules for fiscal year 2024 activities and programs pursuant to the strategic directions established in the fiscal year 2024 budget resolution adopted by the Board of Managers. So Brianna Yates will be presenting.
Okay, I will go over the February tentative agenda items. Right now, I don't have that many, but we'll start with strategic planning. We currently don't have anything on February 7th. And then on February 21st, we'll have Budget and Finance Committee, Executive Committee, and the board meeting. For Budget and Finance, we have financials and discuss the process of CEO financial contract authorization, and then a quarterly fiscal and operational update from CUC and Sendero. Executive Committee, we have our standing tentative schedules, and then for the board meeting, currently we have budget resolution updates, performance review update, lawsuit updates, and our annual integral care update. Also in the packet, you will see this schedule. It's our budget resolution schedule. It lists the report out months for every item, and that is all I have.
Okay. Members, any comments on either of these items? No? I have some suggestions that I'd like to make on the report out items. There's a number of items on here that I would like to suggest, or I'd actually like to ask the staff to come back with some additional reporting timelines. These are items that I would like that I'm thinking that we, based on the importance, well, all of these items are important, but based on some activities that are occurring in the community, I think that some reporting that's more often would be appropriate on these. And so let me run through those real quick. I'm looking for my notes, y'all. Let's see. Oh, here they are. Okay. So we have a number of items related to the behavioral health and integral care. And these were items that were passed direction that were passed as part of the budget. And my thought is that having these three items reporting more often to the board would be helpful, particularly in reporting before our next budget cycle. I know that when we pass these resolutions related to, or when we pass the budget direction related to behavioral health and integral care, we had some conversation at that time that we wanted to really understand what was happening, so that for our next budget cycle, we would be able to have conversations earlier and understand whether we wanted to, what we might want to do in the future. So those three are increased funding for BH and SUD programs, services provided by Integral Care. The second one is Integral Care Service Delivery Coordination. And the third one is the ILA with Integral Care. So all three of these are related. So I would just ask the staff to take a look at the timeline that's being proposed and come back to us and see what you could do about perhaps reporting quarterly on those. So see what you think is appropriate for the timeframes. I just want to make sure that we all understand what is going on with those in plenty of time before the budget. And it may be that those reports go to the Budget and Finance Committee as opposed to the full board. I just think they need to come back a little earlier. Did you want to say something, Manager Misaki?
Yes, thank you. Thanks for that. And I think something that we also need to probably include the jail services as well.
Yes, I agree. Mm-hmm.
Because they're all somewhat interrelated. We wanted to have ample time to discuss this amongst us and with the appropriate individuals and parties.
Okay. Did you?
Yes,
Okay.
we got that. And so we can huddle with the executive sponsors of these items and come back in February
Okay.
and see what we can do to report more frequently.
Okay. Did you want to say anything else?
So if these are the suggestion is for them to go through the Budget and Finance. So maybe we can just from now on have a standing item, just report at every single meeting, and whatever we have available, we can discuss it at that time. It's just a reminder of these items. Even there might be some reports that month, they may not, but at least it's just a good reminder for us. Is there?
Okay.
Okay. A lot of these priorities that were set, the process has been to go through Strategic Planning Committee.
I don't think she meant all of them.
Okay.
Right? You were
No.
talking. She was just talking about the first two that are budget related.
Their budget.
Okay.
Yes.
The behavioral health integral care one and the jail diversion, right? Is that what
Correct.
you
Those are the ones that have some budgetary item, unless I don't recall something.
All of these are strategic budget priorities that are in the budget resolution. And so typically when it comes to tracking and reporting on how we're performing on these strategic priorities, the reports come back through the Strategic Planning Committee, and we've been working on, and they all have budgetary impact, but tracking the performance on how they're being implemented comes through strategic planning. And we have a monthly meeting that, as kind of the strategy lead, work with Dr. Brinson on preparing kind of the future presentations, and then we confer with Brianna and Perla to, put the chart together. With everything that's been going on, we haven't done that. We have the meeting. We had to reschedule our meeting for this month, but we are going to be putting together a schedule of how we'd bring those presentations forward. And I think it makes a lot of sense to take this into account and look at what we can do to move some of this reporting up.
If during your meetings, is Jeff present?
Well, these aren't for the Budget and Finance Committee, but he absolutely could participate.
Let me.
Yeah.
Yeah, I think these items are unique in the sense that there is a financing component. So let me give one example. So on the behavioral health integral care ones, what we passed was up to the $7 million, but there's also language in there about whether or not there are additional dollars that needed to be considered. And that might be a budget and finance issue. So perhaps you can work with both Dr. Brinson and Manager Musaitis to figure out where that might be appropriate.
Absolutely.
Does that make sense? Does that make sense
Would
to
that
you?
be okay?
Oh yeah, perfectly. And I think as we're moving along and the new strategy that we've tried to do with budget and finance, including you in our meetings, and I think it'll be appropriate if Jeff's time permits as well for him to be part of these meetings. I think we should not work in silos, and to collaborate because this is all somewhat interrelated.
And Jeff is actually invited to those meetings. He comes as.
Okay, I don't
as he
know,
can.
again,
Yeah,
I'm not-
no,
So-
We'll get it
Thank
coordinated.
you.
Yeah.
We'll get it coordinated.
We'll see what we can.
So
do
let
to
me,
coordinate.
there's a couple of other items that I wanted to mention. Okay, there's one related to eligibility, extending the MAP eligibility period. I'd like to suggest that that be reported to us maybe in March or maybe in February. If you would, if you all would consider when's the appropriate time. Right now, I believe it just says as needed, but I think an actual presentation to us on what the options might be would be helpful for our conversation, and you all can think about what the appropriate month is to do that sometime in the next few months. Okay, thank you. Then the two items related to homelessness, the medical respite and the street medicine mobile clinics. I wanted to suggest twice a year. I think they're mentioned as maybe once a year now. So if you could take a look at that and see when you think might be appropriate. The Central Health Navigation Center, I wanted to just ask if you all could consider a quarterly report on that, the status of the Navigation Center. That's the one that talks about care coordination and other kinds of issues like that. So, and again, when I'm suggesting this, I realize there's work involved, so I'm not talking about a long presentation. I'm just talking about helping the board understand how things are going. And then the last one is the high need region engagement. I think right now it's listed to present in Q4, and I think it would be helpful for the board to understand, to understand both what is being planned in terms of engaging the public in these high needs regions, as well as what might happen during the year. So y'all can look and see what you think is appropriate, but I was thinking maybe the second quarter and the fourth quarter. Does that make sense? Okay.
It does, and I know you also emailed me some of these suggestions. Let me go back and huddle with the executive team, because I also want to make sure that that when we come back that we have
I'm sorry, say it again.
meaningful activity to report, and that the timing, works out, and also just in consideration of bandwidth and other projects that are ongoing. So we'll look at the report again and
Okay.
come back in February.
Dr. Brinson?
Yes.
Sorry to put all this on you, but since we're discussing it, we were thinking that the Eastern Crescent hasn't gotten a lot of attention, and we haven't had meetings in a while. So we were thinking, since Del Valle is hopefully wrapping up, that we could spend a little time looking at our next projects for, in that region, and see if what we're thinking of strategizing for the future.
Are you talking about clinics?
Oh, well, just whatever we just, I don't think we have a clear idea of everything that region may need. So if they need, well, I know we're building the clinic, but past that.
Okay. I might want to understand that a little bit better.
Well, my concern has been all the people moving into town, are they still all moving into the same areas? And if so, how, if we're going to double our population by, 2030, what should we be thinking about for that?
Okay. All right. Let me think on that one, and maybe we can talk a little bit more about that offline, and
Yeah.
then so I can better understand that.
Right, thank you.
Sure.
Okay. All right.
Oh, yes.
Did you finish?
Okay.
Do you have anything, Dr. Morton? Do you have anything? Well, first, committee members, do you have anything else? No. Okay. Manager Jones?
We had talked about the Eastern Crescent resuming their meetings. We were hoping and expecting the facilities to be further up and operating. I understand Hornsby Bend is now. I know Dell Valley is in the process of steel construction, so our goal was to hold off until then. However, it's the beginning of a new year. I would encourage allowing this opportunity to have some time doing strategic planning to talk about strategies as they come on board, but also not only the strategy for the Eastern Crescent, but also what outreach efforts are out there ongoing or need to be doing.
Okay. Did Manager Valadez, did you? No. Okay.
Thank you, Shannon covered it.
Okay. All right. I'm going to move on now. There's no motion necessary for number 3. Okay, so we are now to item number 4, confirm the next regular executive committee meeting date, time, and location. So managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, February 21st at 4 p.m. or immediately after the Budget and Finance Committee meeting at Central Health Admin Offices, 1111 East Caesar Shop S. At this time, I'm ready to accept a motion for adjournment of the Executive Committee. Manager Musaitif moves. Dr. Brinson seconds. All in favor? Unanimous. Okay, members, we're now going to move to our Board of Managers meetings. I'm going to go ahead and move us straight into that because it's 4:22, so. All right. So, good evening. Today is January 24th, 2024, and it is 4:22. As a quorum of the board is in attendance, I would like to call to order the meeting of the Central Health Board of Managers. And managers, tonight I'm thinking that in looking at our agenda, I'm thinking that we can shoot for perhaps wrapping up at 7 or 7:30. What I'm going to try to do as we go forward on these in these meetings, I'm going to try to give us a time frame at the beginning of the meeting so we can all kind of know what we're working towards. Now, that doesn't mean that we're going to stop any discussion. So, I might be wrong, in terms of what I'm estimating. But I think it might be helpful for us to try to understand how our evening's going to unfold. So we'll see how we do. Maybe 7, maybe 7:30. We'll see how we do. So, okay. The first item of business will be the consent agenda. We have 3 items on the consent agenda. Do I need to read those items? Yes, okay. Item number 1, approve the minutes of the Central Health Board of Managers December 13th, 2023 meetings. Item number 2 is to receive and ratify Central Health investments for December 2023. Item number 3 is to approve the formation of the Ad Hoc Infrastructure Committee created by the board chair as recommended by the Executive Committee. So do I have a motion for approval of the consent agenda? Manager Motwani, going to read that.
I move that we approve the consent agenda.
Okay. Items C1 through C3.
Items C1 through C3. I'm sorry, I don't have a motion sheet.
That's all right. That's fine.
Thank you.
Second from Manager Valadez. All in favor?
Aye.
Okay. Thank you. We will now proceed to the regular agenda. The first item on the regular agenda is to announce appointments to the Central Health Board committees. So members, I had the opportunity to talk with each of you in making these appointments and sent them out earlier in the month. I wanted to emphasize that my goal as your chair is to really support each of you to participate in the way that makes sense for you and also in a way that puts you in a position to really pursue your passion. I mean, you're all on this board for a reason, and you all bring a lot of expertise and interest to the board. So that's what I'm trying to do, and so I invite you to let me know at any time. Offline, just call me and let me know if you feel like you're not having that opportunity. The other thing is just for all of us to remember you know, we're a collaborative board, and so we can all participate in any of these committee meetings. If you want to at any time, you're welcome to do that. So, okay, no motion necessary there. I want to thank everyone for participating in these committees, and I want to thank you all who have agreed to chair these committees. And I want to thank Manager Motwani for agreeing to chair the ad hoc infrastructure committee. I know you'll probably have a lot of interest from the board in helping out in that committee. All right, I'm going to move on to item number 2. There's no motion necessary on item number 1. Item number 2, receive, discuss, and take appropriate action on a presentation of the Central Health Fiscal Year 2023 financial audit. And so Jeff Knodel with Jimmy Rommel from Maxwell Lock and Ritter will be presenting.
Thank you. Jeff Knodel, Central Health Chief Financial Officer, and as you mentioned, Jimmy Rommel with our external auditors at Maxwell Lock and Ritter. We are requesting action tonight to accept the auditor report related to the Central Health 2023 external financial audit. We had an extensive presentation at Budget Finance Committee meeting last week, and as our practice, we ask our auditors to come back and just report their findings, their comments, their required communication to the Central Health Board of Managers. So with that, I'll turn it over to Mr. Rommel.
All right. Thanks, Jeff. Good afternoon, everyone. As Jeff mentioned, we'll be going through the slides this afternoon, probably a little bit more, a little less detailed than we went through with the Budget and Finance Committee last week. So if you want to move on to the next slide for me. So just one thing to point out, there was a new section in the audit this year because there was a requirement to do a grant audit because federal grant expenditures exceeded $750,000 during fiscal year 23. So in this overview of the audit report, you'll see there is a new section this year related to that reporting. So, and I'll touch on that when we get to a further slide in the slide deck. Next slide, please. So we are issuing a unmodified or clean opinion, which is the highest level of assurance we can provide as your external auditor. Next slide. So as part of our audit, we do review key processes and internal controls over financial reporting, as well as we do perform our audit under government auditing standards. So we were just reporting that there were no material weaknesses in internal controls over financial reporting and also no reportable instances of non-compliance under government auditing standards. Next slide. As I mentioned, this year we did perform what's called a single audit because the federal grant expenditures exceeded $750,000 during fiscal year 23. The program that we tested was related to the COVID-19 disaster grant program that was passed through the Texas Division of Emergency Management, and there were about $2.2 million of expenditures in relation to that grant. So we are issuing an unmodified or clean opinion on compliance for that major federal program. And then also, we're reporting no material weaknesses in internal control over compliance in relation to that program. Next slide. Some additional communication that's required to be presented to the governing body is on this slide. So there was one new accounting standard that was implemented during fiscal year 23. It impacts a little bit of your balance sheet, brings on some right-of-use assets in relation to subscription software agreements, and then a corresponding liability related to those agreements. So actually, there's not a whole lot of net impact on your financial statements, but that was one new standard that was implemented during the year and is effective now for any fiscal years going forward. We had no difficulties in performing the audit. We definitely want to thank everyone here at Central Health for all their assistance with the audit this year. No significant audit adjustments as part of our audit process, and also no disagreements with management during our audit this year. Next slide. So the last two slides just kind of go through at a high level the statement of net position and the statement of activities. So as I pointed out, there was the impact of the new accounting standard in 2023, so that will be reflected in that column in relation to 2022. But overall, no significant changes in regards to the reporting requirements on the statement of net position. And final slide, please. And once again, this is going to be your statement of financial position. The one line item you'll see that's new is the UT affiliation agreement. That Central Health made a payment in relation to that agreement during fiscal year '23. But all the other information is consistent with what's been presented in prior years. Then, as I mentioned, the new accounting standard that was implemented in relation to those software subscription agreements. And then also there were two new certificates of obligation that were issued during fiscal year '23 that amounted to about $99.4 million of principal. And then we do review compliance under the Public Funds Investment Act as part of our audit, and we noted no instances of noncompliance under the PFIA. And then, as I mentioned, the outstanding bond balance as of the end of the year was about $173.1 million of principal, and $7.4 million of that is going to be due in fiscal year '24. And with that, I'll open up to any questions you may have for me.
Managers, any questions? Okay, Manager Busaitis?
Mine is not a question, more of a thank you for Greta for Central Health and for your presentation. I am happy of the outcome of this audit and much appreciation to the staff. And as you mentioned during our meeting last week, you did not have any conflicts, and the staff was very friendly and open to sharing your the documents and the information that you needed. So the process was smooth on that end. And again, I commend all the efforts done on behalf of Jeff, staff, finance, and everyone, and Beth, and everyone. Thank you all for a great and clean audit. Thanks.
Other questions or comments from?
Yes, thank you. I just, for the record, am wanting to clarify that we have two different reports, a budget report that is presented, and this, which is called an accounting report. What is this? I just want to make sure that I understand that, because when I asked you where the reserve accounts amounts were listed, you said it was incorporated in the unrestricted at the last meeting, or am I mistaken? And if so, then please clarify to me exactly where to find those and in which report we're going to be receiving every month.
Yes, and Manager Valadez, I believe this is an audit report, but Jeff, can you speak to her question?
I'll take that one. So yes, we have two separate reports that we present. We present monthly our budget to actual expenses. Those are more on a budget basis type of financial statements. This is a financial statement. We do it every year. It's required, I believe, by the bylaws. External audit firm comes in and does all their required work, and it's done more around generally accepted accounting principles, not in as much that our budget to actuals are done that way, but the reporting format is a lot more prescribed for a financial audit. So it's a lot different look, so to speak. So it doesn't show budget to actual and things like that. It's really just a financial report of expenditures and revenues and net assets, as you were talking about. So the second part of your question again was, the question you asked last meeting, which is related around reserve balances. And again, there are prescribed reporting formats that the accounting standards require around net assets. But when you look at our budget to actual monthly reports, our reserve funds, the emergency and the contingency, are part of the unrestricted net assets. But there are other items in the net assets also that are included that are not included in our reserves.
Thank you very much for clarifying that, because when I asked you that question before, I asked you if the unrestricted amounts included the contingency and emergency reserve funds. I didn't get a very clear answer. There was no yes or no.
Well, I think
But
I think my
appreciate
answer.
you-
No,
Well,
I think my
Manager
answer
Valadez,
was.
I think it's-
let's
thank you
stick
for
with what
clarifying.
we got right now, okay?
No, I
Did you get an
No, I
answer?
just wanted to say thank you for
Okay.
making it
Sure.
perfectly clear, and that is what we will be seeing throughout our financial reporting during the time, I guess every month when we have our financial reports, and whether or not there will that end up being an item, a line item included there, or will we no longer see that in the reports?
First of all, last week I did answer the question. Yes, it was a part of unrestricted net assets, and I said it was a subset of that. So it's the same answer as what I'm giving this time. And secondly, when we presented the November financials, that line item was there, and we'll continue to report in that format, so it's not going to disappear or anything
Good.
in that regard.
Thank you. Thank you very much.
Okay. I'm not seeing any other questions. Can I have a motion?
Yes, and also to confirm, Mr. Kanoto did answer that question. And my motion is, I move that the board accept the Central Health Fiscal Year 2023 financial audit as presented by staff and outside counsel.
Okay, have a second. Dr. Martin, seconds. All in favor?
Aye.
Okay, it's unanimous. Thank you.
Thank you very much.
Thank
you.
And again, thanks to the staff. I think I just hope Patty and her staff were the ones that really do all the work to put all this together. So thank you.
Thank you. Item number 3 is, so managers, item number 3 is just receiving an update on the fiscal year 2024 budget resolution priorities. There's no presentation on this item, but there's material in your backup, and staff are available to answer questions. So no motion is necessary. I'm going to move on now to our closed session. So for items number 4, 5, 6, and 7, we're going to go into executive session. And let me read those items. Item number 4 is discuss and take appropriate action to approve an interlocal agreement with the City of Austin regarding a partnership with the City of Austin, Central Health, Travis County, and Integral Care to collaborate on addressing homelessness. Item number 5 is receive and discuss a briefing regarding Birch et al. Versus Travis County Healthcare District, DBA Central Health and Mike Giesland. Cause number D-1-GN-17-005824 in the 345th District Court of Travis County. And item number 7 is discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including pending issues and next steps in the redevelopment of the Central Health Downtown Campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County. So agenda items 4, 5, and 7 are under Texas Government Code 551.071, consultation with an attorney. And agenda item number 6, which is receive an update and take appropriate action on an employment contract for the president and CEO position. That one is under Texas Government Code section 551.071, consultation with attorney, and Texas Government Code 551.074, personnel matters. So I announce that the board is convening in closed session. So are we ready for closed session? Oh, the time is 4:39. Thank you. Are we ready? Okay. Okay, we're out of closed session at 7:28 on the 24th. And we have 2 action items. We will take up item number four first, excuse me. And I think Manager Musaitif has a motion for us.
Yes, thank you. I move that the board delegate authority to the president and CEO to negotiate and execute an interlocal agreement with the city of Austin on terms that are the same as presented by staff and by board input in closed session, and a funding level directed by board discussion in closed session.
And second? Dr. Brinson, we second. All right, all in favor?
Aye.
Aye. Opposed? Okay, that item passes unanimously. Our next item is item number 6. Do we have a motion, Dr. Brinson?
I move that the board approve the execution of an employment contract with Dr. Pat Lee as the Central Health President and CEO.
Second? Manager Valadez? All in favor?
Aye.
Okay, that's approved unanimously. Okay, our last item is number 8. We will confirm the next regular board meeting date, time, and location. Our next Central Health Board of Managers meeting is tentatively scheduled for next Wednesday. No, not next Wednesday, sorry. That's, okay, for Wednesday, February 21st at 5 p.m. at Central Health Admin Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment. I'd like to note that it's 7:30. All right, who's? Okay, we have a motion from Manager Musaitif, a second from Manager Motwani. All in favor?
Aye.
Okay. Thank you all.